Hello and good afternoon, everyone. From Manila, Philippines, I'm Dennis G. Lusaya from the Department of Surgery, Section of Urology of the University of Santo Tomas, Faculty of Medicine and Surgery, and currently the chair of the Institute of Urology at St. Luke's Medical Center, Philippines. It is a pleasure for me to give this presentation on managing big stones with the Lithoclast. Let me take this opportunity to thank the chair of the organizing committee of the 18th Urological Association of Asia Congress organizers, headed by Professor Myung Soo Cho and Kyung Si Lee, as well as the chairs of the scientific committee, Professor Xiong Il Xiu and Il Yong Xiu. I have no financial interest and disclosures. The European Association of Urology guidelines in urolithiasis recommends strongly percutaneous nephrolithotomy as a standard of care for large renal calculi and the standard access tract as small as 18 French to as large as 30 French. There are several methods of intracorporeal lithotripsy, and the most popular of these is the use of the pneumatic or ultrasonic system, or in combination for rigid scopes to achieve fast and safe fragmentation and extraction of renal calculi. The use of holmium laser is recommended for flexible and miniaturized rigid endoscopes. The Swiss Lithoclast technology has been around since 1991 and is considered the gold standard in intracorporeal lithotripsy, with over 12,000 systems installed worldwide with a stone-free rate between 70 to 90%. The Lithoclast has rendered over 12 million patients stone-free, and as a testament to its success, there are over 170 articles written and published in the PubMed. The pneumatic system alone provides a powerful fragmentation of or pre-fragmentation of hard and big stone. With a wide range of probes of different sizes, it is a safe alternative for intracorporeal lithotripsy for large ureteral stones and considered to be the standard before the arrival of the Honing laser. The probe is lightweight, ergonomic, and easy to handle. Switching and connection to the ultrasonic device to provide combination ICL is easy. The pneumatic system of the lithoclast is based on the Newton's cradle kinetic energy of a projectile propelled by a burst of compressed air against the head of a metal probe at a frequency of 12,000 cycles per second. This is responsible for breaking up stone once the tip of the probe comes in contact with the stone, very similar to what the jackhammer does. The ultrasonic system provides a fine fragmentation of soft stone, and with its hollow probe, one can perform and continuously apply suction device to complete removal of the smaller fragment. The probe comes in different sizes and therefore can be used in ureteroscopy, standard and mini PCNL, in pediatric stone cases, as well as for management of bladder calculi. It easily couples with pneumatic lithoclast for combination lithotripsy. The ultrasonic device works when the electrical impulse from the generator is transmitted into the piezoelectric piezoceramic elements in the handpiece. This creates a longitudinal vibration at a rate of around 25,000 cycles per second that is transmitted to the hollow metal probe when in contact will cause the stone to disintegrate. The combination of both pneumatic and the ultrasonic can efficiently fragment large and hard calculi. As shown in this slide, the ultrasonic will create what we call the laser-like drilling effect, while the pneumatic will fragment and disintegrate the stone through the jackhammer effect. Evacuation is finally accomplished through the hollow probe of the ultrasonic system connected to the suction device. The manufacturer EMS is in the forefront of technology for the past 29 years, constantly evolving and innovating. And recently, they have a variety of miniaturized probes with a three-in-one function of pneumatic, ultrasonic, and suction in one piece, and they call it the Swiss Lithoclast Trilogy. From the original Swiss Lithoclast pneumatic lithotripter in 1991, the Lithoclast has evolved into the combination in 2001, to the Swiss Lithoclast 2 in 2005, to the portable Swiss Lithobreaker, to the holmium laser, which is known as the Swiss laser class, and to the current Trilogy, or the Swiss Lithoclast Trilogy. The Trilogy is a single handpiece and probe containing controlled in a single control box and a pedal with a combination of pneumatic, ultrasonic, and suction at the same time. This is for fast, efficient, and safe stone removal and disintegration in one. Now, what is the evidence regarding why it still remains the gold standard intracorporeal lithotripter? In the previous RCT, small number of patients reported by Pietro trial comparing pneumatic alone compared to combination and ultrasonic and pneumatic in 20 patients with large stones, it showed that the combination is superior in terms of rapid stone disintegration and clearance as compared to the pneumatic lithotripsy alone. In a larger randomized trial by Lehman et al. Involving 30 patients with staghorn calculi, they recommended the pneumatic and ultrasonic intracorporeal device for large and harder stones, whereas the ultrasonic for softer stones. They compared the device-related problems when ultrasonic lithotripter was used as monotherapy. In a much larger trial involving over 200 patients and three different intracorporeal devices, that is the Cyber 1 ultrasonic, the Swiss Lithoclast combination, pneumatic and ultrasonic, the Stonebreaker, and in combination with the Olympus ultrasonic LUS2, the stone-free rate and the complication rates were similar in all the three devices, but the Lithoclast combination has a faster stone clearance rate involving larger and harder stones in that trial. We manage our big stones in our country with prone PCNL and slowly transitioning to supine for moderate to partial staghorn calculi. Our technique of prone PCNL involves upper pole access under fluoroscopic guidance and occasionally in combination with ultrasound in selected cases. To the upper pole access, through the bullseye technique in the AP plane, we align the shaft and hub of the access needle to the posterior superior calyx. Once entry into the desired calyx is confirmed, we pass the guide wire down into the ureter and into the bladder. For more complex stone, in a prone position, we perform a planned, precise, perfect posterior calycial puncture with a pre-inserted guide wire to the intended calyx far down to the ureter. Dilatation of the primary tract in the superior calyx is performed with a fascial dilator or occasionally with the use of a high-pressure balloon. We use an amplat sheet of 22 French in majority of our cases. In majority of our cases, we perform mini PCNL using an 18 French microscope and perform stone fragmentation initially using the Lithoclast pneumatic system, especially for hard stones. Once the stones have been broken, we follow it up with an ultrasonic lithotripter system with suction to, to remove the remaining fragments. In majority of our cases, a single upper pole access will be able to render this patient stone-free. And in certain occasions, when we have a complex stone, we need to add multiple access to remove certain stone not accessible by our primary track. This is our personal experience of over 60 patients involving three medical centers for the past 10 years, involving big stones or stagnant calculi managed with the little class alone or in combination, ultrasonic and pneumatic. So we have a total of 65 patients with a median age of 48. Majority of our patients were male, and majority of the stones were on the right side. On the right side, a mean stone size is around 30 millimeters, ranging from 25 to 70 millimeters, and an operative time with a mean of less than an hour. Our hemoglobin drop ranges from 1 to 3.5 grams, and majority of our patients have stents placed after the procedure because of the complexity of the stone burden. Majority will have a nephrostomy tube for 1 to 2 days and it is removed up before discharge. The length of the hospital stay is usually 3.5 days, and there is one patient who had blood transfusion. The number of tracks number from 1 to 4. Our stone-free rates after 3 months is approximately 87%. Certain patients undergo auxiliary procedures such as shockwave lithotripsy, retrograde intrarenal surgery, or repeat PCNL. In summary, the advantage of the Lithoclast, it is an ideal intracorporeal lithotripter in a local setting where resources are limited. It is very efficient with a wide range of safety. It is successful in fragmenting stones irrespective of composition in 70 to 100% of cases. The combination device provides faster and safer removal of large stone burden. The tip of the probe doesn't generate heat. It is relatively low in cost and maintenance. Very minimal disposable cost. The Lithoclast probe, especially the pneumatic, have an extremely long lifespan together with the ultrasound probes. And thank you for your kind attention.